Hello, I'm Dr. Bamonte. I'm here to chat with you a little today about cats and emergencies.
Dr. Bamonte, what are the signs that my cat is having a medical emergency?
So there can be a lot of signs, of course, but the biggest ones that we worry about would be issues like labored breathing, weakness, changes in mentation, profuse vomiting, obviously wounds or bleeding. Those are the biggest emergencies typically.
How can I tell if my cat is in pain?
Ooh, cats are tough. So they're very good at hiding it. Cats typically will show pain by hiding. If you find them, again, not frequenting their normal spots. Sometimes they will urinate or defecate in strange places. Avoiding eating, avoiding social contact. Those are generally the most common signs. Obviously, if they're limping, constantly licking an area, anything like that can be signs as well.
What should I do if my cat is choking?
If they appear to be choking, where they truly can't seem to take a good breath or pawing at their throats, I would take them straight to the closest open veterinary clinic, ER or otherwise.
How can I safely transport my cat to the emergency vet?
So I would try to get them into their carrier. That way they're not loose in the car and stressing themselves out even further. So if you can get them in their carrier, that's ideal. Otherwise, of course, just giving them to us, but ideally in a carrier.
What should I do if my cat is having a seizure?
So the hardest part, I think, with a seizure is knowing that you just have to wait for it to end. Don't try to get them out of it because the seizure just has to go through its course. They're not going to swallow their tongue or anything like that, so do not mess in their mouth because you're more likely to get bitten. Reasons to take them to an ER for a seizure would be if the seizure is lasting longer than 5 minutes or if they have multiple seizures in one day.
How can I tell if my cat has been poisoned?
So some of the symptoms that we'll see, there's a lot of different kinds of ways they can be poisoned, but vomiting, drooling, weakness, again, changes in mentation, anything like that, they could have eaten something or gotten into something that's poisoned them.
What should I do if my cat ingests something toxic?
So if you see that they ingested something toxic, I would call the veterinary clinic or bring them to us right away. Typically, if they've eaten something within an hour, we can induce vomiting. Now, not everything. There's some things that they eat that we don't want to make them throw it up. So it's always always call us and let us know. But if it's within an hour, we can induce vomiting. If it's after an hour, sometimes we can give them charcoal to help get it to not let it absorb into the GI tract, and they may need other treatments. So just try to contact or get them to a veterinarian as soon as possible.
What are the signs of heat stroke and how can I prevent it?
So heat stroke, typically the symptoms are going to be, again, weakness, probably open mouth breathing or panting. Preventing it, again, I would just, especially if it's an indoor-outdoor cat, try to keep them inside during the heat of the summer. I don't see a whole lot of heat stroke in cats. They tend to, not be as prone to it as dogs, or we're not taking them as many places as we do dogs. But any symptoms where a cat seems to have labored breathing, I would just bring them in.
What should I do if my cat has been hit by a car?
So try to carefully pick them up and bring them here. The problem is if they're in pain, then they're more prone to biting. So just be very careful with that. Try, just like if you have a human in a car wreck, you want to be careful because we don't know of any internal injuries or broken bones. So be very gentle. If you have like a makeshift stretcher, you could try to put them on that, like any kind of hard surface, get them into a carrier safely and bring them to us.
How can I stop bleeding if my cat has a cut or wound?
So if your cat will let you, you can try to put on a makeshift bandage. If the wound continues to bleed or it's open enough that it probably needs stitches, then again, I would just get them straight to us, and we'll usually sedate them and do what we need to do.
What are the signs of a urinary blockage in male cats?
So typically these kitties will be in and out of the litter box a lot, and they're usually crying or yowling. They make a very loud crying type vocalization. But if they're doing that and you're not seeing any urine in the litter box, and they're typically uncomfortable and kind of bloated in their abdomen as well, any of those symptoms are definitely an emergency. So I would take him to any regular veterinarian or ER if they're closed.
How can I tell if my cat is having difficulty breathing?
So cats, if they're open mouth breathing, like panting, that's always a concern. So any open mouth breathing, coughing is not, very common in cats. If they're using their abdomen visibly to take a breath, then they're working too hard. So any of those symptoms, I would take them, very soon, if not emergently, to a veterinarian or ER.
What should I do if my cat is vomiting or has diarrhea for more than 24 hours?
So I don't know that is always an emergency. That is, if they're otherwise bright and alert and they're, eating, then I would probably just take them the next time that your normal veterinarian's available, unless it's profuse vomiting or, again, if they're very weak. But if they're having vomiting and or diarrhea for greater than 24 hours, we probably should consider some testing, some x-rays, things like that to figure out why it's persisting.
What are the signs of a severe allergic reaction in cats?
So it depends on what they're reacting to. If it's anaphylactic reaction, they can have, again, weakness, labored breathing, open mouth breathing, acute swelling, welts, things like that in different places, like vomiting profusely, anything like that. I would be concerned. Let's pause it.
What should I include in a first aid kit for my cat?
So I would have basic bandaging material, and probably it, because it's so tough with cats to try to treat them at home. But I would probably just have some basic bandaging material, maybe some, a triple antibiotic wound cream, some saline to flush out wounds. But that's probably where I would start with them.
What should I do if my cat's eye is injured or swollen?
I would probably not try to do anything at home. I would, if they seem comfortable, try to get them, to the veterinarian as soon as you can. Obviously, if they don't seem comfortable, or if it's traumatic, that's when I would take them to urgent care or ER.
How can I tell if my cat has a broken bone, and what should I do?
So if they are obviously limping or non-weight bearing on a limb, and it persists longer than a day, I would definitely take them. Again, as we've talked about, cats are very good at hiding pain. So sometimes they won't tell us right away that they have a fracture, but any persistent limping or pain upon petting or touching them at home, I would bring them in.
And last question. After an emergency, how should I monitor my cat's healing or progress?
So it depends, of course, on what they were being treated for. I would, usually after you're at the ER or with us, anybody, they're going to send you with directions and time of the next recheck. So I would just follow that. If they're indoor, outdoor, I would probably keep them inside until we know that they're 100% back to normal. But again, usually you'll be given very explicit directions on monitoring at home and rechecks. Any questions at all about cats and emergencies or what to do in a pinch, please feel free to reach out. Thank you.